Okay, we'll call the meeting to order. This meeting takes place in the traditional and ancestral territory of the Mi'kmaq people. We are all treaty people. Just want to start by saying we welcome Councillor Greek. He's zooming in tonight because he's representing town at a tour today in Yarmouth, and then we have a conference tomorrow starting there. So he had to go a day early, so he's down south for the night. So we'll move on to there's no additions or deletions to the agenda. So move to number 4, approval of agenda. 4.1. There's a recommendation here that council approve the agenda for the April 14th, 2026 meeting as presented. Is there moved by Councillor Strong, second by Councillor Fullerton. All those in favor? Or Deputy Mayor?
It says the 14th and we're the 28th. So we're approving the agenda for today.
So with that correction, are we good? All those in favor, raise your right hand. Motion carried. 5.1. There's a recommendation here that council approve the April, it says 14th, but I'm going to say 28th, 2026 meeting minutes as presented, but that is the 14th. Yes. So are you good with that? Who's going to move that this time? Moved by Councillor Babineau, seconded by Deputy Mayor. Oh, Councillor Greek also got his arm up. All those in favor, raise your right hand. Okay, so now we'll move on to 6.1, working together to support community well-being, and I'll invite Lois Hopper up.
Hello? Okay. Perfect. Are you going to scroll from? Okay, perfect. So hi, everyone. For those of you who may not know me, my name is Louise Hopper. I'm a health promoter with Public Health here on the South Shore. Thank you for giving me the time on your agenda this evening. It's nice to see you all and to have this formal opportunity to connect with you as council. I've had the opportunity to meet some of you in various contexts, whether it's community committees, community engagements, or even chats over coffee. And I know some of you were on council when I presented about my role back in 2018. Over the past 8 years, there have been a lot of changes in our community and within council, so I thought it was an important opportunity to come back and reconnect with council of the town of Lunenburg. Specifically this evening, I'm here to talk about my team, the Healthy Communities team of Public Health, and how our work aligns with the town of Lunenburg, and to explore opportunities for us to collaborate to build healthy, sustainable communities. There are many examples across Canada of how public health and municipalities work together. In some jurisdictions, public health actually works directly within municipal units, bringing health equity and population health to planning and decision making. This isn't the case here in Nova Scotia, so we are doing our best to build relationships with each of our individual municipalities to ensure that we are able to identify opportunities to work collaboratively. So today, I'm just sharing a snippet of what those possibilities might look like. So next slide. Yeah. So I thought I'd take the first moment to talk a little bit about who's who in public health. So who are we when I refer to public health within the context of Nova Scotia Health? So sometimes there is a bit of confusion about public health and how we complement the healthcare system. So public health is a program within Nova Scotia Health. However, we aren't involved in direct patient treatment or the acute care health system. Within our program, public health has 3 main focus areas, and it just disappeared, but that's okay. Continue. So there are 3 main focus areas. So the first, which many of you may be familiar with, is our early years team. This team is comprised of community home visitors, community outreach workers, and public health nurses. So this team focuses on the continuum of supports for prenatal to early childhood. You may be familiar with prenatal services or our enhanced home visiting program, where a community home visitor will see new families in their home if it is determined that they might need a little extra support adjusting to life with a new baby. While these supports focus on the parenting journey, staff often help navigate complex systems to help support their housing, mental health, and even food security needs. Go back. Oh, yeah. You're probably also fairly familiar with our health protection team. This team is primarily made up of public health nurses and licensed practical nurses who are responsible for supporting and implementing our provincial vaccination program. So, for example, our school-based immunization programs, and are also responsible for documenting and responding to notifiable diseases and infections in the community for which it's required by law. So measles, rabies, tuberculosis, Lyme disease, anything that's provincially required by law. So finally, I'm a member of our third stream, which is our Healthy Communities team. Our focus is on promoting health and well-being by addressing inequities and addressing the root causes of ill health. On our team, we have dental hygienists who support our school fluoride varnish program and work to promote dental care as part of overall health. We have nutritionists who have been involved in policy work around healthy eating in recreation, school, daycare, and healthcare settings. And more recently, we're involved in the development of the So Short School Food Project and other food insecurity initiatives. We have a school team, which is comprised of a school health promoter and a youth engagement coordinator who support the So Shore Regional Center for Education to improve student and school community and well-being. And we also recently, over the past couple of years, have added youth health center coordinators to our team. So those positions are currently available in all of our high schools across the region. And then finally on our team are our health promoters. So that's me and a few others. We have 4 health promotion staff across Lunenburg and Queens County. And I'll talk to you a little bit more about our specific roles in the coming slides. Now, Ken. Next one. So I wanted to put, again, public health in the context of healthcare overall. So by being next, back up. It's all right. It's like I don't have control. So by virtue of being part of the health system, there's often a lot of confusion in the community about our role and why we aren't directly involved in certain types of services. So where public health differs from the many other health professionals in our health system is that we focus on the health of populations and the multitude of factors that contribute to positive or negative health outcomes. So rather than treating illness, we focus on prevention. So the mission of public health is to work with others to understand the health of our community and act together to improve health of the population. So essentially, this means that we engage in surveillance, data collection, community consultation, and other methods of understanding the health of our population and what factors influence their health the most. Using this information, along with best practices and evidence, we work with our communities, partners, and all levels of government to address those factors impacting the health of our population. So, next one. So this is just a simple graphic that illustrates the many factors that influence one's ability to achieve overall good health and the environments in which we are exposed to them. So these factors range from early childhood development and access to education, to income security, connection to community, and how our communities are designed, to climate change and exposure to discrimination. Many of the factors listed here directly overlap with your existing priorities and responsibilities as a municipality. For example, built environment, neighborhood safety, anti-racism and equity, and housing. As a municipality, you are uniquely positioned to have influence in all of these areas. From making resolutions, writing letters of advocacy to other levels of government, providing grants to community organizations, to larger initiatives like your municipal planning strategies and land use bylaws. All can positively impact the quality of life of Lunenburg residents. Next slide, please. So how do we do our work in public health? Often I get the question, well, what do you actually do? It's like, well, how do I describe what I actually do? So our work kind of falls in 4 main models of work or ways of working. Most of it is done in partnership with community. So some of the skills, roles, and expertise that we can bring to our partnerships include the following. So assessing community health. So I spoke a little bit about this already. So as a public health system, we work to assess the health of our communities, and we use that data to influence policy and decision-making, program planning, and resource distribution. We can support knowledge translation for our partners, and this could include accessing existing data sources, supporting our partners with data collection, creating data resources like policy briefs, and more. We also work in community mobilization. So what does that mean? So we work with community on those socioeconomic factors that I've previously described in the other slide. So this includes building community understanding and capacity for action and advocacy. We also work to develop strategic partnerships in our community. So as public health, we always work in collaboration with others. So the issues that we work on are extremely complex and require a whole of society approach. We work with various partners to support action on those social determinants of health through healthy public policy. So some of our partners include municipalities, community health boards, other programs within Nova Scotia Health, our school system, not-for-profits, and many other organizations and service providers and community. We also do our work through advocacy and developing and implementing policies. So we work to support development of healthy public policy. This can include supporting new policy development or reviewing existing policies and strategies, conducting health impact assessments for decision-making, and collaborating with community on advocacy initiatives. So next slide. So I'll go through these quickly, but you have them in your slide package. So I just wanted to take a few moments just to highlight, okay, so that's the context, but what does that mean in practice? So how are we actually showing up in Lunenburg County on the South Shore as it relates to these kind of 4 buckets of work? So one example under assess community health. So if you aren't familiar, hopefully you will be come next spring, but public health does support the community and service-based homelessness count that is conducted in our communities. So the last one was conducted in November 2024. So that is a project that we work with Acadia on to kind of do an assessment of the current context of homelessness in our communities. So we identified through that project how many folks are experiencing homelessness or are at risk of homelessness, and some of the assets and challenges that those individuals are facing. So we will continue to partner with Acadia this year, or I should say 2027, will hopefully be the first year that that count is actually happening provincially. So right now it's just happening in pockets across the province. So next year we're hoping to have the whole province covered. Under advocacy and developing public policy, a couple of the examples is we helped prepare a housing and health policy brief for the town of Bridgewater recently. Myself, I've helped with the municipality of the District of Lunenburg. We were asked to provide some advice around the rezoning that took place in Osprey Village, so we can provide a public health perspective to municipal planning and land use bylaws. And even prior to COVID, I worked with staff here at the town of Lunenburg around the sponsorship policy. So we can help municipalities review and develop new policies. Developing strategic partnerships. This is a big one. Many of you may be aware of the South Shore Housing Action Coalition. So that is an example of an initiative that started within public health itself as a way to learn about housing in our community and has grown over a decade or more to become a very active community coalition on the South Shore. And then finally, community mobilization and engagement. A new initiative that's grown over the past year is the Beyond Band-Aids initiative, which is basically working with community to identify kind of what are the big issues that community is facing and how can we support individuals in community, not just organizations, but just individuals to build their capacity around advocacy. So next. So finally, I think I hopefully have a couple minutes. I just wanted to take all of what I've kind of shared around how we do our work and just highlight a few examples specific to the town of Lunenburg about how, in my role as a health promoter, I can be there as a resource to staff, as a resource to council, and partner and support your work towards creating a healthy, sustainable community. So what I did was I took a few of the themes that are currently in your community, your comprehensive community plan for the town, and just highlighted, what might that look like? How could public health actually support that work? So if you look at, for example, community structure or urban design, I already mentioned that public health is able to support planning departments when they're looking at developing or revising municipal planning strategies or rezoning particular areas of your communities. Environment and sustainability. So we have recently been engaged in some work around wildfires. So last year we had some significant wildfires in our province. So bringing a health equity lens to emergency preparedness and emergency planning so that we're not after the fact thinking about those people who are most vulnerable. So how are we ensuring that people are getting the information they need and the supports they need regardless of if they're experiencing disability or accessibility issues, communication challenges, how are we making sure that those folks are equally as supported during emergencies? Economic development. So we're not heavily involved in economic development, but what we can do is bring a lens to our communities around well-being economy. So how do we look to shift our economies away from traditional capitalist models to more health promoting well-being economies? And what might that look like for a community? Next slide. And then just a couple more quickly. Housing is a big one for public health. It's also, I know, a big one for municipalities. It's coming up a lot. So as I mentioned, we are supporting the community-based homelessness count, but we can also work with municipalities around exploring what the continuum of housing might be, like what are the types of housing that might be needed or beneficial for your community. So supporting work around that. Mobility, for example, we have been heavily involved in active transportation in the past. I actually sat on the Town of Lunenburg Active Transportation Committee a number of years ago before it was dissolved, so public health can bring a lens to that work. And then in culture and recreation, we can bring, again, I use equity, the word equity lens to a lot of this work. But how do we look to ensure that community spaces, for example, are protected for public good and that they aren't experiencing encroachment from industry or corporate or private interests, and that we can protect green spaces and public spaces for everybody to use? So that's just a snippet of some of the things that we can support our local municipalities with, specifically the town of Lunenburg. I hope I've shared a few ideas of how we can potentially partner together going forward. And in my closing, I just wanted to note that I sent my slides before some stuff started happening here locally. So I just wanted to take a moment. I don't have a slide, which that's okay. But I just wanted to talk a little bit about the recent decision or exploration of councils to continue or withdraw membership in the Joint Municipal Anti-Racism, Anti-Discrimination Advisory Committee. So I know it's on your agenda tonight, and I think there may be some folks in the gallery that will be coming to talk to you a little bit about that as well. But I just wanted to say that I'm not here tonight to influence your decision, but I did want to share, just from a public health perspective, a few thoughts I would like you to consider as you're deliberating your decision. So as you reflect on what this work may look like going forward for your community, I just wanted to leave you with a few questions to consider. So no matter what the decision you make tonight is, think about how you, as the town of Lunenburg, will work to ensure that community, those with lived and living experience and first voice, are fully and authentically engaged in the development and implementation of your anti-racism plan. This is a requirement by the province, but it is more important than just a checkbox task. So consider how that might look like going forward. This work is a priority, especially in the current climate that we're living in. So how will the town ensure that this is not simply a task that has to be completed off of the side of someone's desk, and that adequate attention and resources are allocated? And then finally, municipal boundaries exist from a governance lens. However, for most people, their lives are experienced beyond those boundaries. There are a number of reasons why cross-municipal collaboration is important, from efficiency, so not duplicating efforts, to assuring that no matter where someone works, lives, or play, they can expect similar experiences. So think about how the town will work collaboratively with other local municipalities in the potential absence of an actual formal structure to ensure that where it makes most sense, efforts are managed at a regional level versus by community. So these questions may not be part of your discussion this evening. However, as you move forward with your next steps, I'd implore council and staff to fully explore how these things will be part of your planning going forward. And just to align this back to kind of my final slide, is that public health, our health promotion staff, are here to help with that work. So whether you decide to move forward as a joint committee and continue the work with other municipalities, or you go out on your own and take on this important task, public health is here to help with that work. So please, I encourage you, request public health input, pull us into your engagement work, wherever you may need some assistance. This is the work that we're here to do. So please call us in. And that's the end of my presentation. Thank you.
Thank you very much, Louise. And on the last issue you've raised, that is on the agenda later on tonight. Unfortunately, as you'll hear later on tonight, our decision to stay in or out is probably a moot point at this point, because
I realize
Bridgewater made their decision last
Yeah.
night to pull out.
Yeah.
So the committee actually officially is dissolved
Yeah.
because 3 out of the 5 have left.
Yeah.
Mahone Bay has agreed to stay, and then we're going to be discussing it later on in our agenda.
Yeah.
But I'm really glad to see that you do work with municipalities on equity, inclusion, and anti-racism, because we do realize how important this is and how delicate it is, and we have to do it right. So whichever we decide later tonight, it's glad to know there's some people out there willing to step up and help us put this plan in place.
Yeah.
So the regional approach, as much as we thought it would work, obviously that decision has been made before we get a chance to decide what we're going to do. So no, thank you. And does anyone else have any questions for Louise?
Through your worship, just some information for council. So we will have a social media policy coming forward in May, and we did actually approach public health to talk about what can we have as guidelines or principles for mental health and well-being as it comes to social media for council staff and public. So it was very much appreciative of public health's input and Ms. Hopper's support within that process. So we're already engaging with public health and see many opportunities within the scope of what we have to work.
Thank you, Deputy Mayor.
Louise, I just wanted to thank you again for this update and for this reminder of what you do. I think it's really important that we understand, the breadth of what public health is involved in within our communities. And I do recall our previous collaboration on other policy development items. So I think it's important to maintain those strong relationships and draw on the expertise that's available where it is available. So thanks very much for what you do, and thanks for the presentation tonight.
Any other questions or comments? Thank you very much.
Thank you.
We'll now move on to 7 public input and questions. There are 2 people signed up. Each person is limited to 3 minutes. You must state your name. Questions or comments are directed through the chair. Comments and questions are open to any municipal matter. And that's really the rule. So we'll start with Yvonne Mosley.
Okay, sorry. Some of you I know, some of you I don't know. So my name is Yvonne Mosley. I've lived in Lunenburg since 1993. And at some point, I was asked to go on the original Lunenburg committee on racism. And unfortunately, that was a little bit excruciating. It was very academic. It was not practical. There was no leadership. And then there was a transition into the regional committee, which seemed to me to have all the possibilities of all the makings for a good working group. So I'm very sorry to hear that this has fallen by the wayside with some communities, but I would like to encourage you to consider working with Mahone Bay and Chester, but perhaps under a different, rather than becoming academic, just become practical. So one of the things that sticks in my mind in terms of racism, and I notice that we're all white in here. Everybody's white, actually. We recently did a film on systemic racism, and one of the things that sticks in my mind is a young Black woman talking about waking up in the morning and what she had to face in the way of racism. We don't wake up that way. We don't wake up thinking, what are the punches that are going to come my way today? We have none of that. So anyway, all that to say, I would just encourage you to continue doing something about racism. And I think that there are solutions, but I don't think they're academic. I think they're actually fairly simple. And a part of that is about consciousness. So thank you very much. That's all I have to say.
Thank you, Yvonne, and nice seeing you again, by the way. Next up is Deb Beers.
Sorry. The sudden knee issue. I just have a knee that's gone on me, so I've been without this cane for a long time. Anyway, I'm reading mine because that's the way I do it best right now, because there's too many options or too many things I want to say. Can you all hear me? Yeah. Okay, and thank you very much for letting us speak to this issue. Good evening, my name is Deb Beers, and I'm a resident of the town. A few years ago, I was part of a group that created a film that dealt with systemic racism. It was an eye-opening experience for me because I met and got to know participants with lived experiences. Our participants who gathered information for the film were Black Nova Scotians, Mi'kmaq, and Acadian, and who themselves had experienced racism issues. They then gathered additional information from interviews that they filmed. Because of the discussions and interviews because of this and the discussions and interviews, I gained a much deeper understanding of the depth of racism that exists in our province. I am here to speak to the item on the agenda that deals with the future of the Anti-Racism and Anti-Discrimination Committee. I understand that the Town of Bridgewater Council's actions last night means the committee was immediately dissolved. Therefore, tonight's discussion here will take a different direction. There are many options for how this town can continue this work. I see this as a real opportunity to add Lunenburg Council's voice to that of Mahone Bay Council. This will signify to the public that the town of Lunenburg is fully committed to doing this challenging and, as we know, sometimes very difficult work. When the original committee was first formed a few years ago, it was a hopeful time. The idea that the 5 municipalities in Lunenburg could work together and there would finally be a coordinated way to include underrepresented communities in Lunenburg County through this collaboration. I hope that this council will do what they can to ensure this latest development will not take a step backwards. Perhaps there are ways to work with the town of Mahone Bay, and since they voted to continue this committee. We know that if anything is to be achieved that will have true impact, it should involve the whole region. We also know that there are, we also know that there are many coordinated or committed people in this community who have passion, skills, and will to bring to this discussion. In closing, I just want to mention that one of the most important things we learned from making our film was that acceptance of all groups in our community must start with education, both formal and informal. Thank you for your time. That's all I have to say.
Thank you very much,
Yep.
Deb. So what we're going to do now is we're going to go to 8 and then 9, but when we get to number 10 on the agenda, since we have you folks here tonight, we're going to go on number 10 right to 10.5, and we're going to deal with that on the agenda. That way, you fine folks can go home and enjoy the rest of your evening. So we're on correspondence right now. Number 8, there's one correspondence that we should be dealing with tonight, and that's 8.1, that council proclaim May 2026 Lyme Disease Awareness Month in the town of Lunenburg. Is someone prepared to move that? Moved by Councilor Strong, seconded by Councilor Fullerton. Any discussion on that? All those in favor, raise your right hand. Motion carried unanimous. 8.2 is just there for information. There is nothing under number 9. So then we'll go right to 10.5 on the agenda, which is the Lunenburg County Anti-Racism and Anti-Discrimination Advisory Committee and Agreement. So, Paul, you.
Thank you, Your Worship. So tonight, council, before you is a report on the Anti-Racism, Anti-Discrimination Advisory Committee. As stated already, 3 of the main municipalities within the organization for the regional model have removed themselves and pulled out of the actual agreement process, which essentially absolves and stops the work on a regional level. So just a little bit of background here. So we did join into the committee there approximately 2 years ago. There's no question that there was a need for a focus on anti-discrimination within the community and to develop the advisory committee and within the provincial mandates that have occurred recently. There's no question that this work is essential, that it has to be done, and why it is legislated in provincial government and why it's been brought down to local levels for towns to deal with. When we looked at this, there are several processes that have come in. Overall, there were 2 different coordinators through this process. I recently came in with this as part of my hiring as being a CAO for the town here and understanding just the complexities that are within the scope of regional development of this. and that there were partners within the scope that were at different levels and different understandings of the direction of where this could go on a regional level. The regional framework did include the intermunicipal agreement, the establishment of the advisory committee, the shared racism and diversity coordinator, and the look at the development of the plan. This was supposed to conclude and wrap up after 2 years at the end of September. Council, in the discussion pieces, it just breaks down the anti-racism advisory committee, why it was established, the diversity coordinator within the processes, and some of the items that were noted as difficulties as it came to the ERDAC positions and as to the planning processes. We will note that our chair is actually Councillor Babineau for the committee, and staff did meet with the ERDAC committee to discuss the positioning of where the committee was at the beginning of April. And they did bring forward a recommendation to council, which you have in the minutes as a part of the agenda package, where there was a pathway forward or a model that we felt could work within the scope of this, and that staff did value that ERDAC and the representatives would provide good input and insight to our ongoing planning and processes. What was identified were structural challenges identified within the regional staffing model, the committee capacity, and the coordinator capacity that was involved within this process. In the end, there was, again, staff, we do feel that there could have been an opportunity for further regional collaboration from my standpoint as representative of the town within this. It is unfortunate that there has been a want from other municipalities to step away from this. But in the end, we are all still mandated by the province to submit a plan going forward. And how do we do that? So there should be some approaches of supports when we look at this, that there is clear accountability to council, that aligns with the local priorities of council, direct engagement with underserved and underrepresented communities, and measurable progress that we can take actions within this as the town. As noted, there are many resource options that are available to us, as you just heard from Public Health. We've actually been in contact with the Office of Anti-Racism and Equity, who want to discuss options of how they can provide supports to municipalities that are in the processes of developing plans or achieving the goals of their plans. So overall, council at this time, with the regional model essentially defunct, with the majority of members, municipal members stepping away at this time, council, I leave the motions to you that are before you tonight to look at direction and how we proceed.
Thank you, Paul. And I'd just like to add that I'd like to thank all the volunteer citizens that agreed to serve on that committee while it was in place. Again, I think that when anyone steps up to volunteer for a committee, it's honorable, and they obviously, it was important to them. So again, I want to thank them, and whatever direction we decide this table decides to take here shortly, maybe we can use some of your resources in the future. I also want to thank, before we move forward, Councillor Babineau for taking on the role of the chair of the committee, because even back when she took on that role, the committee was having some issues, but Councillor Babineau stepped up and did everything in her power basically to try to keep the committee moving forward. Unfortunately, we're now at a point where I guess the brakes have been put on. So I just want to again thank those volunteer citizens that signed up, and we understand as a community how important this is. So that's all I have to say about it at this point. But Councillor Babineau?
Yeah, I do. Thank you. I do have some comments. So as has been alluded to, I'm the current chair of this now dissolved committee. And I want to thank those who got up to speak tonight from the town. I appreciate that. I am going to try and stay too far out of the weeds with my comments. I will just say that I am, of course, disappointed in the early dissolution of the committee. I think that we could have used the remaining time to maybe do a bit of a deeper dive into what went wrong. But what I really wanted to focus on was, and the mayor stole some of my comments. I really wanted to acknowledge the citizen representatives who I had a bit of a chance to get to know through this process. I'm sure that this did not go as they were hoping or planning for, but they were all willing to give of themselves, their time, their experiences, sharing that in a way that is, I'm sure, very vulnerable, to offer their expertise on this particular subject and their lived experiences. I hope that they are willing to continue to do that in whatever way works best for them. I'd love to be it with us. But really, I feel like they should all be really acknowledged and applauded. So that is what I'm doing tonight, is applauding them. And hopefully they'll see my comments at some point. I would be happy to move a motion forward, but if someone else has any comments they'd like to make first, or no, okay. So I'm going to move regarding the secondary direction that we're going with here, because obviously the primary decision has been made for us. I would move that council direct staff to engage with the town of Mahone Bay and other interested municipalities to explore the potential for a restructured advisory or resource sharing model.
It's been moved by Councillor Babineau, seconded by Councillor Strong. Any discussion on the motion? Deputy Mayor?
Yeah, sorry. I would just say that I think that it really needs to be emphasized that the dissolution of this committee does not mean that we don't prioritize the work of anti-racism and anti-discrimination, because it is vitally important. And as was pointed out by one of the presenters earlier, we are not best equipped on our own to address this very important work. So wherever there are resources available to us, either through formal organizations and experts in other parts of government or other public agencies, and also within the community, we need to up our game in addressing this through policies, programs, and what so have you. We do have a bit of a draft, I think, as a starting point, which was through the work of the regional committee. I'm not at all opposed to engaging specifically with Mahone Bay, because I think they seem to be of a similar mind in what we've determined at this point. I just wouldn't limit it to that. So I hope that staff could explore engaging with Mahone Bay and as it says, other interest municipalities and other organizations, even to come up with a recommendation as to how we might ensure this gets the attention it deserves. So I guess the direction to staff isn't different. I guess I just wanted to sort of add emphasis to things that I think need to be recognized in that work.
Thank you. Any other comments? Councillor Fullerton.
I think it's important that we continue the work of this committee, and it is a mandated course of action, and I think it's very important. It's very important to people in Lunenburg, and it is very important regionally that there's a voice to speak to these issues that everyone faces. So I'm absolutely supportive.
Councillor Daphne.
I'm totally behind this, because I don't know how you can be a counselor for a town that has many different people in the town. And if you don't have their feedback or their life experience, I don't think we speak for the entire town. So I'm disappointed in my other municipal colleagues, but I think this committee is needed. I think we've danced around this issue for a long time, and I'm glad we're going to do it.
Counselor Strong?
I am totally in favor of the motion and want to see it move forward. And I think, as one of our speakers pointed out, sometimes the path is hard and it's tough. And this just may be another part of that path that's telling it it's hard and tough. And maybe we step back and think about it a little bit and then keep going. I would like the committee, however it goes forward, to revisit Justice Sinclair's recommendations and take from those recommendations what are really important to observe and implement in any kind of a plan. Because I know that's one voice that's really missing.
Thank you. And before we vote, I would just like to add that's sort of related to this, that just so the people know, we do have a very solid and respectful working relationship with all our neighboring communities on a regional level. This committee just had some issues right out of the gate. And I guess some felt that they've given it long enough and it was time to pull out. But we will continue to work with our neighboring communities regionally in future projects. So this certainly doesn't mean the region doesn't work together well, because we have a lot of other examples that would say differently. This committee sometimes committees just don't work. So this is nothing against our regional partners at all. We will still all be a better place to live, work, and play if we work together as communities. So again, I just want to stress that this isn't anything about that. So again, I'll call for the vote. All those in favor, raise your right hand. Opposed? Motion carried, unanimous. And thank you very much to everyone around the table for taking the time and effort to think clearly about this very serious issue. And thank you so much to the folks that spoke tonight. It's very well appreciated. And if you want, I'll take a couple-minute recess if you guys want to go home, or if you actually want to stay and watch, that's up to yourselves. Okay, so 10.1 is the updated paid parking meter bylaw, first reading. There's a motion there, but before we go into the motion, Kayla, I guess you're up.
Yeah, thank you. So I'll keep it brief as this is the second time council has seen it, but tonight we do have a recommendation here that council approve first reading of the parking meter bylaws presented in the agenda package. So as I just alluded to, council first reviewed this draft at its last committee of the whole. And at that time, council was generally supportive of the bylaws presented and no key changes were requested. But just a couple of things we're looking to clarify here tonight. One of those would be if council agrees with removing any reference to daily parking permit. So as we note in the report, staff do not recommend these permits at this time because the proposed bylaw already provides flexibility through low hourly rates, limited paid parking hours, and then the removal of maximum time limits in those key areas like Blue Nose, Pelham, and Montague. So as a result, we don't really think the permit at this point would provide much benefit. Also, some operational challenges of we can't issue the permits on hotspot currently, so people would have to physically come into town hall. That might create some confusion. And then also thinking of Saturdays when we're closed. And so I can see that being frustrating to folks on the app. And then the second thing we're looking to confirm is if council is comfortable removing paid parking for January and February. So we typically don't make a lot of revenue in these times. Operationally, it can be challenging as the parking meters often get covered in ice and snow. And predominantly we're seeing our residents out there using it. So while we don't have resident parking permits, this is something we could offer in the slower seasons as a little incentive to residents. So with that, that's a report. And Shania and I are both here if anyone has any questions or you want us to go over any sections of the bylaw.
Thank you. Any questions for Kayla? Deputy Mayor?
Couple little minor questions in just reviewing it again. I fully agree with the changes that are being proposed, actually. I love the idea of January, February, especially seeing the revenue generated. And the fact that, it is parking meters form, they're not just to generate revenue, they're also to move people along, and we don't seem to have a problem with that in January, February usually. So so I think it's a great and a great thing to institute. The same, and understandably the complications with daily parking permit, justify removing that section from the proposed bylaw. I wondered, and this, I may be off base with this, but just it's the purpose of the bylaw is to regulate paid parking, and I wonder if it's to regulate parking. And I have to give some thought. I kind of questioned it when I read it, but because parking, I guess, is available other than the paid parking, and I don't know if that's seen as part of what the bylaw dictates or indicates or not. But anyway, just some food for thought on that distinction, whether or not it should be there or not. And maybe it needs to be there. I'm just kind of ruminating on that. I also wondered about, or I didn't understand, or I wanted to clarify the role of the Municipal Government Act, which is referenced in the bylaw too. So I guess it's a summary offense under the Municipal Government Act as indicated in the policy. And so I guess that's because the Municipal Government Act is the piece of legislation that gives us authority. So without that, there would be no offense. Is that right?
And just to clarify, so the way that we do paid parking tickets here in the town of Lunenburg is through a voluntary payment. And so under the Municipal Government Act, we are allowed, so it's kind of linked in with the Motor Vehicle Act as well, but we are allowed to have voluntary payments. So these payments actually come to us first, and then with a time limit. So you'll see within 60 days, you can pay this to the town. And then if not, we have the mechanism to move it to the provincial summary offense ticket, which would be more expensive than this $25. I think it's 62, 61 or something along those lines. So we have that first built in to collect the payment, and then it would go to the province and be a higher one through summary offense.
And so there are 62 that's determined by the province, not us. Okay, okay. I wasn't clear on that, so that's helpful. Just the commercial loading zone exemption. I just question whether or not the 15 minutes is realistic. I think it's important to have, a not exceeding or some sort of parameters around allowing that, because I think it's necessary. So, and I again just throw that out for discussion. Maybe it's lots of time, but I was thinking of somebody, having to get their dolly out and unroll a whole bunch of stuff, and I just kind of thought, maybe that might be a bit challenging to meet that time frame. So just questioned it. That's and the other thing I questioned and was the time frame, and I know we had changed this a long time ago, and not sure if I recall exactly the rationale, but we moved it to 10 a.m. for allowance, which is quite generous. And I guess I wondered if that's still what's best for people coming in the morning. And I am not equipped to answer that. I mean, I think that would be, for the downtown businesses to sort of weigh in on, and maybe they have, and they think 10 is the best time frame to start. And I guess I'm thinking of, some of our small hotel operators in the downtown core. I'm thinking, their guests probably maybe park on the street when it's free, and it's nice to have till 10 to clear out. Maybe that's the justifiable time frame. And I'm just sort of thinking, well, things happening earlier in the morning, is that fair to people who are coming in earlier? So just a thought.
I can actually comment that there's really nothing but now the post office, but besides the post office, right now, the only business that opens before 10 on Main Street, for example, would be Kinley's. On the lower street, there's only one or two restaurants that actually do breakfast, and none of them would be open until 11 or 12. And even where I am, there's two or three that don't open till 11. It seems like, don't ask me why, but since COVID, when you were supposed to work reduced hours and this and that a lot of people have stuck with a lot of those hours. So I don't think 10 is a problem. I would have said it was definitely before COVID came along, but now, like I said, the dollar store and Kinley's are the only two places that I see open before 10 o'clock. And the post office, of course, right? So yeah, I would say the 10 o'clock's probably fine at this point, just from personal seeing what I see. Usually if I go down the street and need to load up my car, I'll go around 9 or so, because I can always get right in front of there because there's no one on the street part because there's nobody open. So any other questions? Go ahead.
Not a question about the bylaw exactly. And I know that it was mentioned about in our staff report, I think, about the fact that there's some education upcoming about it, some information flyers, and I just and Councillor Straw may weigh in, but I was just wondering about using the library and some of the library patrons to help. I know I had a conversation recently with one of our sort of older citizens who's, was very relieved that the parking meter, the fashion coin, as a local person, that was still an option. And I mentioned, it's not, once you try it, it's really not that difficult. And, just some familiarization opportunities might be helpful for some people to kind of get climatized to using that. I'm assuming many of our visitors will be quite comfortable, but for local people, that they may find it works quite well once they, get used to the idea. So.
Yeah, I think that would be a great idea, actually, because once you get the older population out here and they get everything entered into that app, then it's just going on from there. It's pretty simple. So that's a great suggestion.
Councillor Strong.
I can bring that to the South Shore Regional Library board too at our next meeting, but there is a one workshop that happens, I think, twice a month on these kinds of things, so I can see it fitting in there. Maybe we need some help from the town and having it happen. So I'll make that question up for them.
On that whole issue, I did have a text out of the blue today from a lifelong resident, older than me, that said they were scared basically when they went down, downloaded the app, and it worked incredibly well. It was basically as easy as could be. So she just wanted to thank us for going with an option that was basically user friendly. So that was really good to hear. So, because I think it is wise that we keep accepting coins at this point. But again, to hear that from that individual was great. The other two comments that I would make is one's more a comment, the other one is a suggestion, but I'm glad to see the parking tickets finally going up, because now it'll actually cost you money if you don't feed the meters, whereas before it was cheaper actually to take a chance of getting a ticket. So that'll hopefully prevent some things. And then the other thing, because I think we currently do it, but we should actually put it in, I think, number 2 under discussion, number 2. We're officially making exemptions for volunteer firefighters, which we've been doing, but it wasn't official. And we talked about this a bit this afternoon in our deputy mayor CEO meeting, that currently there's only a handful of handicap spots in the downtown core. Technically, if they park at a metered spot because the handicap spots are taken, they're supposed to feed the meter. And I don't think we ticket a lot of them because we don't think it's right, and I don't think it's right. But if the wrong person sees you not ticket them and you ticket them, they could come at you. So just to make it all above board and legal, I think where it says exemption for volunteer firefighters and handicap spots, I think we should put in there, because I think it's a little ridiculous that, for one, a fully capable, healthy 20-something-year-old firefighter can park anywhere in town for nothing. But if you legitimately have a handicap sticker, you got to pick one of them blue spots, which are very limited in town. And a lot of times the few in the downtown core are taken. So again, I think that we should maybe add that, so we're not putting our staff in a position, because technically if they do call and say you walked by, you didn't do what you were supposed to do. So I think by adding that, if it's a big issue, adding that, I'm okay. But I think it just makes things a little more black and white if everybody's okay with that. Okay. Besides that, I think the bylaw is a great document. And like I said, I'm sure we'll be tweaking it down the road, but again, I think it was long overdue. So thank you to staff for putting this document together and just about touching on everything. So thank you very much to those of you that took the time to work on this. So we do have a recommendation in front of us. Someone prepared to move that. Moved by Councillor Fullerton. Is there a seconder? Second by Councillor Babineau. Any further discussion on the motion?
Do we have to add that we're taking this out into that motion?
No, but just for clarity, we can say that we're gonna, before it comes back for second reading, you'd like to see the accessibility permits under the exemption. Perhaps looking at bumping up the loading zone from 15 to 30 if the consensus is there. And everyone seems okay with 10 a.m. as a start time for unpaid parking. And just to clarify on what Deputy Mayor Bailey had brought up a thought, the intent of this, unless council wants to see something different, is to regulate the paid parking. So the usages of the app and the parking meters, parking as a whole outside of it would be a different process that we would look at. And I think Alan sitting over there is going to talk to you guys about parking at some point down the road. So this is just focusing on regulating like the parking app and the paid parking options.
Thank you. Anything else? All those in favor, raise your right hand. Opposed, motion carried unanimous. So now on to 10.2. There is a recommendation there in front of us with 3 blank spots down below. I'd just like to add that we did ask people if they're interested to reach out. So in conversation, I actually have the Deputy Mayor Bailey, I have Counselor Strong and I have Counselor Greek that have put their names forward to serve on that committee. So if someone's prepared to move those two recommendations, we do have a report.
Sorry,
Yeah.
for clarity, council, so the public understands what you're discussing. We're talking the Community Grants Ad Hoc Committee. So at one of the recent Committee of the Wholes, council directed staff to bring forward a report that would highlight the development of an ad hoc committee so that we could go through a process of evaluating the community grant applications that have been brought forward and submitted with a deadline of April 30th this year. I know we have quite a selection of grants to choose from and that will be evaluated. So this committee would be comprised of 3 counselors and at least 1 staff member to be appointed by myself. And then from there, information would be shared with council before it would come back for committee review and then back to a recommendation to come forward at a future council meeting for recommendations on community grants. So that's the report.
Thank you. So hearing the report and hearing the names that came forward, do we have any questions for Paul or someone prepared to move the recommendation at this point? Because I mean, this is very early in the process. Someone want to move recommendation? Go ahead, Councilor Felton.
Yeah, I'd like to motion the recommendation number 1, that council approve the establishment and composition of the Community Grants Ad Hoc Committee for the 26-27 funding cycle to include 3 members of council and 1 staff member tasked with reviewing grant submissions and providing funding recommendations to council, and that council appoint the following members of council to the committee: Councilor Bailey, Councilor Strawn, and Councilor Greek, and further that the staff member be appointed by the CAO.
The recommendation's been moved. Is there a second? Seconded by Councilor Daphne. All those in favor, raise your right hand. Motion carried unanimous. Now recommendation number 2. Who wants to take a crack at that one?
I'll do that one too.
Okay.
Oh, no, you go ahead.
You guys arm wrestle over
We
it.
can, take turns. I move that council direct that any community grant applications received after the primary 2026-27 intake deadline be considered subject to the availability of remaining funds within the approved community grant budget, and that the community grants ad hoc committee be reconvened where practicable to review such applications and provide funding recommendations to council.
So it's been moved. Is there a seconder? Seconded by Councilor Daphne. Any further discussion? All those in favor, raise your right hand. Motion carried unanimous. Thank you. So we're on to 10.3, policy amendments, low income exception. Are you doing that, Paul? Paul.
Thank you, council. So before you tonight is the low income property tax relief policy. This is a policy that's number 71 in our that is based on our procedural policy. You've already made the motions. Actually, you've already instilled these numbers based on the passing of the budget, which does increase options for gross household income. So you're talking $37,532 or less. They can get an exemption of $1,500, $37,533 to $43,371, $750 exemption, $43,372 to $49,210 would be a $375 exemption. Anything over $49,211, there is no exemption. This is a standard policy that has been in place, and it's just changing the numbers based on the budget that was passed accordingly. Council.
Thank you. Are there any questions for Paul? Just like to highlight that when we went through this, we asked how we compared with others, and our threshold is actually lower than our other municipalities, which means you need to make a lower amount of money to actually qualify for, say, the first level, and it goes to a higher point. So again, I think that staff did a phenomenal job on this, and I think we should be proud to say that we give relief to the folks that make within that realm of income. So, Councilor Strong.
I agree with the mayor, and I also want to point out that this is how we make things affordable as much as we can. So yeah, congratulations to staff for doing this.
So we needed that recommendation by somebody. Paul can't make it. Deputy Mayor.
I would move that procedural policy number 71 be updated to reflect changes to the income brackets and exemption amounts of gross household income of the numbers presented and the exemption amounts as presented.
It's been moved. Is there a seconder? Second by Councillor Babineau. Any further discussion on the motion? All those in favor, raise your right hand. Opposed, motion carried unanimous. Next, we're on to 10.4, which is the recommendation about the Lunenburg walking tour lease, and it's Paul.
Thank you, Council. Seems to be the night that I can provide some reports to you. So this is more of an administrative process. We are in the process of reviewing all leases, encroachments, and agreements that are in with the town. This is just the next one to come forward. Normally speaking, the authority of the CAO can approve a one-year lease. This is a longer-term tenant that is looking for a 5-year lease with a term with an option of 2 one-year extensions. That we maintain the current monthly rental rate and adjust accordingly based on the consumer price index or your CPI. That there was one additional amendment request. Right now, there's no early termination clause, but there was a request in the event of hardship. So this is if there's an illness or something along those lines that we declare hardship, that 90 days written notice can terminate the clause early. And that was just based on a good process that we're looking at as we move forward with any of these agreements. Beyond and that we update the name because it was reflective that they used to be C Spot Travel Limited to Travel Lunenburg Limited, and those are the main changes that are being recommended this evening.
That's the report. Any questions for Paul? Deputy Mayor?
Still on, oops. I'd be happy to move the recommendation that council approve the lease extension agreement with Travel Lunenburg Limited respecting the municipal premises located at 97 Callbeck Street, Lunenburg, including a 5-year term with 2 optional 1-year extensions. And I'd just like to say that I think bringing this lease renewal to us was a prompt for me that perhaps we should have a review of the lease arrangements within the Lunenburg Academy. I know that there is another lease that will be coming up with a vacancy in the building with one of the tenants there now. So it would be an appropriate time, I think, for us as council, because we weren't in place when a number of the agreements were in place. So be helpful to have a review, but that's a separate ask aside from the motion that was made as recommended.
So it's removed. Is there a seconder? Seconded by Councillor Fullerton. Any further discussion on the motion? All those in favor, raise your right hand. Motion carried unanimous. We've already dealt with 10.5. So now we're on to number 11, notice of motions, information requests, and council reports. So tonight I'll start to the left of me, Councillor Fullerton.
Nothing to report except a very busy week this week and looking forward to the conference in Yarmouth.
Thank you. Councillor Greig, all the way down south.
It was a nice sunny day here in Yarmouth, so it was feeling a bit southerly today. But yeah, like the mayor mentioned at the start of the meeting, I am here a day ahead. I had the opportunity to walk through and do a tour of the Yarmouth Solid Waste Park as a representative for the Solid Waste Management Regional Chairs Committee representing the town in Region 6. And it was a great opportunity to see a new initiative that is providing the opportunity to deal with some fishing wastes, specifically waste rope, and turn it into biodiesel. So it was great to see this initiative getting started up and to learn a little bit more about how the regions are working together and some waste management initiatives throughout the province.
Thank you, Alex. Councillor Babineau.
Nothing to report.
Deputy Mayor.
No, I want to thank the mayor and staff for organizing the noon hour ceremony today with respect to the day of mourning, which I think is a very important initiative and annual event, not a cheery one, but an important one. And I too am looking forward to the conference for the remainder of the week.
Councillor Daphne.
Um, Vice,
Oh, geez.
While sitting here tonight about 40 minutes ago, I found out that I lost a friend tonight. We weren't pinky swear friends, but she made me laugh and always smile, and I admired her strength. And the ability to keep things light, but in perspective in what she was facing. They were born and bred Lunenburger, a term that I got called out on, but it was a term that we used in my family, an extended family. I'm angry at myself. As Councillor Strawn knows, I didn't get to visit her. Anyways, her family, my condolences to her family, and she will be missed.
Thank you.
Very light from me. Go get your cookies at Tim Hortons with the smiley faces. You're supporting Second Story. And I too am really looking forward to going south tomorrow.
Thank you. And again, just basically, it's been a very busy couple of weeks. The event today at lunchtime was very well attended, and we have some nice comments on social media from some of the citizens that actually attended it, thanking us for doing what we do. So again, thank you to all of you folks that actually attended, and we had an incredible turnout of staff. I think just about everybody was there. We had to leave some people back to answer the phones and that, but I think everybody else was there. And basically, I as well am looking forward to hitting down south tomorrow around noon. So we'll be back Friday late in the day. So again, thanks everyone for over the last couple of weeks. It's been the last 2 months actually have been very busy. So thank you. So number 12, items for consideration at committee of the whole. The agenda will be getting shortly. And yeah, basically, if you have anything you want to add to a future committee of the whole meeting, just email it to Kayla. Motion action list is always on here for us to review and keep us, I guess, on track. Oh,
Just a couple of things on the motion action list. So we were thinking we could use this as an opportunity for council to review on the record. There are a few things highlighted in yellow there just to remove. As staff, we feel pretty satisfied that they have come to council and have been completed, but we always want to make sure with council before we go ahead and remove those. I don't have it up in front of me, but I can.
so one is the marketing bylaw, which we've approved. Hack and trolley, which we've approved.
And then I believe one of Tyson's reports.
Yeah, we're gonna remove that. Is that it?
I believe so.
Okay, so you guys all good with removing those 3 items from the motion action list? We're almost down to 2 pages.
Tyson?
Okay, or 3, I should say. No, that's great. So again, thank you. And we now need a motion to move into closed session. Moved by Councillor Fullerton, second by Councillor Babineau. Thank you very much, everybody. Enjoy hockey tonight.